Scott Hakala and I are joined by Jonathan McFadyen. He is a nurse practitioner at the Ben Memorial Clinic Pulmonary Department. So welcome.
Thank you. Thanks for having me.
So you heard Scott's story. Is Scott's story pretty typical for those stories that you hear of people who are trying to quit?
For sure. I mean, every day we encounter patients who have similar stories to Scott, and it really is something key within their story of their life, of something finally takes place where they're ready to quit. And just like we heard with Scott's story, you know, his family and his wife, he was just to the point where he was ready to quit. And so that's hugely important for being able to quit. And, you know, we know statistics are out there that people, it takes several times for them to quit. 7 different tries in order for them to be successful.
Wow.
Yeah,
on average.
On average.
Okay.
So.
That's amazing. And people use all sorts of different methods. I mean, I know that Scott worked with Ann Palmer at BMC and did the behavior modification and the exercise and things. My own granny quit using hard candies back in the 80s. Every time she wanted a cigarette, she'd just grab a hard candy. Is there any right way or wrong way to do this?
No, you know, I think the combination of more than just behavioral counseling or support groups is necessary. I think meeting with a good medical provider, getting good consultation, you know, it really has been proven that if you can combine medications for smoking cessation with behavioral therapy is by far the best way to go about it. So you have that support group, but you also have things to kind of combat the nicotine addictive part of it as well, and the withdrawal symptoms.
Well, sure. And Scott, did you use anything? Did you use any medication? Use the patch.
Yeah.
And what does that feel like when you?
Well, the patch, it's just you ingest the needle immediately in step 1 a higher milligram of nicotine. It's actually just you ingest it through your skin.
Sure.
Then it's reduced by we start 21 milligrams, they go to 14 to 17. It's a 6 to 8 week program, and sometimes people double over. They need a longer period of time to wean themselves off the nicotine, which really doesn't take long to get the nicotine out of your body. Once it's gone, then you run into the psychological aspect, the mental aspects, the behavioral modification aspects that you need to really triumph to get over those hurdles.
So like you were talking about, it's really a kind of a two-part combination.
Yeah.
What about, so we know the patch has helped people be successful. I see these ads all the time on TV, Chantix, things like that. Is that another option for people?
Yeah, very effective.
Okay.
I mean, you still want to consult with your healthcare provider to make sure, you know, risk benefits for each patient, but Chantix, Wellbutrin or Zyban's another effective medication to use. So there's good options out there to just help curb and suppress that appetite for smoking.
Do you see a lot of people who are trying to quit? I mean, do we have a lot of people out there who are trying to quit?
Sure, yeah. You know, in general, the CDC show that 70% of all smokers want to quit. So people do want to quit. It's just equipping them with the right modalities to get them successful, the right people to support them through it.
I wonder, because Scott said that, you know, back when he started, it was in college, it was kind of in vogue. I wonder how much the media and things like that plays into, we see a lot of younger smokers now. I wonder how much the media plays into that.
Sure, I think you're absolutely right. I think media really affects everything in our society.
Not good. That's not a good thing. So, you know, chewing tobacco too is something else that we haven't talked about. Is that as addictive as cigarettes?
Sure, just as addictive, same components, the nicotine that affects the body, you get that quick response, so it's very addictive. I
know that my own father-in-law chewed forever and didn't really think that it was harmful to him because he wasn't smoking, you know, he thought he was okay. And then a friend of his had some serious issues. Does it often take something like that to make people kind of wake up a little bit? Usually
there's a life event or something that takes place in their life or someone around them that just hits home to them in a way that didn't before. And they're able to finally say, okay, now it's time for me to quit. Maybe it's a major illness, maybe it's a diagnosis, you know, of cancer or something like that. We hope it's not, but sometimes that's what it takes. Or a grandchild. Yeah. And in this case, Scott's going to have 5. Right.
So. And Scott, it was 2 years for you now?
Yes, 2 years in this coming February 5th.
That's pretty amazing.
2013.
Congratulations to you.
Thank you.
And thank you for coming on to share your story.
Well, it's been my pleasure. Thank you.
Thank you. Thank you. And Jonathan's going to stay with me. We're going to talk more about the details of how addictive this is, what it does to your lungs, what it does to your brain after this.